And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we're going to be talking about TMJ, particularly TMJ issues for people who have gone to the dentist. You've probably had a splint, you've had some kind of an orthotic to try to help resolve what some of the issues are, but you're finding that you're spinning the wheel. And what I want to share with you is something, a little bit of my own personal experience about TMJ, upper neck, and a few little details here that I've really not talked about on too many other videos. In a lot of my other videos, I've talked about the intimate connections between what's going on with your jaw, what's going on with the joints of the upper part of the neck. And go check out those videos there because we go into a lot more depth and detail. But there's a very specific feature that I want to show you that we typically discover more in the upper cervical chiropractic realm that we don't always see when we're looking at, just the jaw in isolation here. And this is something I've had a lot of conversations with a lot of very advanced neuromuscular dentists, and they say, okay, yeah, this is a really, really big deal, but we don't always think to look at it. So let's jump into that and talk about a few things. So first up, what I'm going to share with you is a little bit of my own personal story. I haven't shared all of the details, and yes, I'm meaning to get to that on one of these particular videos. But myself, I've experienced a lot of headaches, migraines, dizziness, vertigo, and TMJ issues over the course of my life. Most of the issues didn't really start till I was about 30 years old, and it took me a really, really long time to even begin to understand what was going on and how to unscramble this. So a lot of it was a process of trial and error leading it to trial and success, because I knew that there was something that was wrong in my neck, and I also had the suspicion there was something wrong with my jaw, but couldn't quite figure out what that was. So let me rewind the clock there just a little bit here, just to set the stage for you, to give you a little bit of perspective. So I was actually born with forceps, and there was an indentation on my skull, and my parents had always wondered, did that cause certain kinds of, damage from a very, very young age. I seemed to grow up relatively well. I had, kids' allergies. I was oftentimes sick, but, relatively okay. And my dad, who was a chiropractor, he was able to take care of me for a lot of years, and things, were just fine as long as that was the case. But it seemed that when I turned about 30, my body said, okay, these compensations that we've been trying to make, we can't do this anymore. And that was when I started to experience all of these different issues. Now, why do I share my story in terms of the forceps? How does this relate to the jaw? Well, I'm going to show you a picture of one of my x-rays so that you can see one of the changes that happened with the base and the shape of my skull, and then I'm going to show you how this relates to a TMJ issue. Look at that handsome fellow right there. A little bit frightful when we're looking at ourselves on x-ray, but I'd studied this a lot of hours here, so I don't mind showing pictures of myself here. So first, for a bit of orientation here, so this is going to be the left side of my head, this is going to be the right side of my head, and I've drawn a few lines for you here. So I've drawn a line here across essentially the corner of my eyes. Reason for this is because in order for your brain to function properly, it's going to do whatever it takes in order to keep your eyes level with the horizon, because they receive so much sensory input about the world that we live in. And it will sacrifice some of the lower structures in order to maintain that kind of relationship. So what I have here, you can see kind of the outline of my skull. So the eye sockets would be in this area right here. And then I've got a series of pink and yellow lines illustrated here for you. And what I'm going to do is I'm going to pull and I'm going to grab a little model just to give you a little bit of orientation. So this would be like we're looking at the base of the skull right across here. And then you've got these little notches right here. This is where your skull meets the top bone in your neck. And you can see that bone, it's kind of shaped, if you would, as I've drawn it right here in a little bow tie. So I've drawn that kind of in the yellow, if you can kind of see that relationship. And then I've also outlined these, they're called occipital condyles, in the yellow outline that we have right here. And then I've put a whole bunch of pink lines across that. So what you might see is that those angles are not symmetrical. So as opposed to the base of my skull being even like this, the right side is actually shorter like that. And that's causing then a roll distortion off toward the right side. And you can see that then, that the C1 vertebra, and this is the brilliance of the body, it finds ways to adapt for this, that my C1 vertebra, it's built up thicker on the right side in order to compensate for that, and then the base of that bone is pretty level. That in and of itself is not the problem. That's one of the ways that the body is going to compensate for this. But what I'm illustrating here for you is that there is this disrelationship. We think of the body as being relatively symmetrical, but the reality is beneath the surface, it isn't. Now, there are two ways that this can happen, and the reason for this is that when we are born, or really up to the ages of around 5 to 7, the skull is not one solid bone. If it was, it would be impossible for us to be born without unfortunately killing mom, and probably killing baby at the exact same time, because there would just be way too much pressure. The skull is soft, and it hasn't completely fused. So if you ever have a significant enough injury, when a person is typically under the age of about 5 years old, it can change it, or it can create a change in the shape of the bone or in the shape of the base of the skull itself. And there's two ways that I can think of that this can happen. Number one would be if I was dropped on my head as a baby, particularly if it created a straight axial compression where those normal bones that were developing, that one of them went like this. Now, I wasn't dropped on my head as a little kid, so I don't think that that was it. What's far more likely is when you use forceps or vacuum, or there's a difficult birthing process, what can happen is it creates a twist in the skull like this. And I'm going to grab my silly little model again here. There is a junction toward the front of the skull. It is deep on the inside. So if I could take my fingers like all the way straight in the middle, right through here, that's where we're talking about that junction is. And what can happen in certain instances is it can start to twist like that. If that happens, the entire base of the skull is going to move up like this. Why does that happen? Because again, your brain says we got to keep the eyes level, so the base of the skull starts to twist like this. And as a consequence, relatively speaking, those two condyles, the base of the skull that your spine sits on, they start to shift like that, and then you have this abnormal plane disrelationship in that way. So you can see that that's going on. That is my normal anatomy. There is nothing that I can do to change my normal anatomy. But then how does this relate to TMJ kind of issues? Go back, watch some of my other videos. Again, alignment of the upper neck is going to affect the TMJ, and the TMJ is also going to affect what's going on in the upper part of the neck. One of the ways that the body is going to compensate for this is it's going to start to produce spinal misalignments toward the right side. And if you were to look at some of the more advanced images that I have done on my spine, I have plain as day misalignments. You see these very distinct distortions, and they're not dislocations or anything like that, but the joints do not sit in normal position the way that they are supposed to. Now, early when I was starting and experiencing all of my symptoms, I'm thinking, that has to be what the problem is. That has to be what's going to fix it. But it didn't work, and I didn't know better at the time. We stuck with that strategy for 3 years, hoping that something was going to go away on its own, and things just kept getting worse and worse and worse. Came to the point where I realized that some of the misalignments that were in my neck were compensations for my bone structure. And if we tried to take those away, because the wisdom of the body said we need those, I just kept feeling worse. That led me then to looking at a few things with the TMJ. Something I had learned a long time ago is that if you're dealing with an upper neck issue that's not resolving, number one culprit is the TMJ. And sure enough, I started getting a lot more pain tightness through here. And you may not be able to see it through my facial hair here, but I'll draw your attention. And if you're looking at the shape of my head here, my jaw actually goes toward my right side like this. So my jaw swings slightly right here. And what that does is it starts to put compression into the TMJ area right through here. So this is what I thought the next step was going to be and how we were going to resolve that. So the next part of the story, I was referred to a dental specialist. I had actually had braces when I was about 18, 22 years old, somewhere in there. And the purpose was to straighten the teeth. But we were straightening the teeth and didn't realize that I had this kind of skull-disc relationship. And what I believe that it did was it actually amplified the issues, and it took the better part of, again, 10 years before the symptoms really started to manifest themselves. Now, this was a gentleman, and I referred a huge number of clients to over the years for the TMJ therapy. He was doing something that was called a soma. So it's a somatic orthopedic myofunctional appliance. The short of what the concept is that if the upper part of the palate is too narrow, either because you had braces and it locked the skull into the wrong position from a young age, person has a tongue tie and the upper palate never developed in the first place, then it creates tension right through here. And the lower jaw will then kind of slide back and it starts to compress in this area right here. So you don't want to expand the upper palate like this, but if you can broaden it using this kind of appliance like that, what that will do is that will actually create more functional space and the jaw will start to come down and this person starts to feel better like that. So I was referred to this doc, really, really good guy, really bright guy. And we fitted an appliance and I actually did. I felt almost immediate relief as soon as I started wearing it. But very quickly, I find that it's like, oh, it's not quite working. Something doesn't feel quite right. And I would go to visit, we'd make a few different adjustments, things like that, but it wasn't quite working. Nevertheless, I did also have a number of other clients where I recognized that they had the TMJ issue. I referred them to him, and they all did remarkably better. I think you can appreciate just how terribly frustrating that is for you as the individual when you as the doc, you're able to make a recommendation, you're able to do things that are helping people out, but then you yourself are not getting the same kind of breakthrough. What it felt like when I was wearing the appliance was that it was actually increasing the compression that I was I had right here. It took me, again, the better part of about 2 to 3 years to realize what was actually going on. So we come back to this particular picture that we've got right here. As you can see, we've got that tip in the base of the skull. What that means is it means that the body naturally is going to be producing more of a jaw distortion into that direction. But here was the problem that we came to realize. And that was that as we were working to try to expand the palate, that works fine when the base of your skull is symmetrical. But if it isn't, as it is in my particular case, what that does is that expands into the point of compression without actually relieving it. In other words, it was making things worse. And here I was thinking, okay, we're doing all of the right kinds of things, but realized when I was chatting then with another dentist some years later that it's like, no. The variation of anatomy that you have, because we can't change that, we can't expand the upper palate in that same way. Instead, what we need to do is we need to actually bring the alignment down the other way to create more functional space on that particular side. We need to be moving the teeth individually, and this is one of the reasons why I refer to neuromuscular dentists. It takes nothing away from the value, the virtue of so many other different forms of dentistry, but when people have more of these complex asymmetries beneath the surface, again, not just the TMJ, not just the teeth, but what's the orientation and the relationship between the joints at the base of the skull, the joints of the upper neck, and the jaw itself. You have to take all of that into combination to actually figure out what do you need to do. So as you see, I have braces on the bottom, not for the purpose of making my teeth straighter, but to shift my jaw more toward the left side so that even if my jaw was like quite over to the left side like this, functionally I would be doing much, much better. And this is what I've been noticing as I've been having this particular kind of care. Well, two things to this. Number one is that the more that we're actually shifting my jaw away from that point of compression, away from the way that my body has caused it to swing over a period of time, I start feeling better. But what we also realized that the misalignment configuration in the upper part of my neck, even though all of the initial signs were saying problems on the right, problems on the right, the reality is no, the problem is actually it's on the left. And it was only by understanding these relationships that we're actually able to figure that out. And I repeat, this has taken over the better part of 10 years. I hope that the course of this video here can illustrate some of these so that people do not have to go through that same kind of process. So again, this video is for people where you know that you've got some kind of a TMJ issue. You've been working with all of the right kind of specialists, trying to get that job, but something is just not quite right. You might have something like this that's going on. And understanding that means that those subtle little shifts and pivots, that can be the breakthrough that you are looking for. And interestingly, in just the span of the last 2 weeks, I have had 3 people come to the practice who have shown the exact same thing here, and that was the impetus for doing this video. Because of my own experience, I was able to identify that they said, I've been to all of these dentists and it kind of helps, but it kind of doesn't. And I've been to different upper cervical chiropractors and I feel like there's something there, but it's like, why is this not working for me? And I'm going to show you their films because guess what? They've got the exact same kind of thing that I do. And guess what? The common denominator is that every single one of them had some kind of a skull injury or a difficult birth. Let's have a look at those pictures. This here is person number 1. So you can see we've drawn the line again across the base of the eyes. The skull, perfectly level there. But what we can also see is that we have that exact same kind of disrelationship with the base of the skull, where everything is essentially shorter on the right side, which is causing the compression and the swing of everything toward the right. I didn't draw a line. Let me actually do that really quickly here. I mentioned that feature about the base of my chin right here. Well, this is going to be maybe not a perfectly ruler straight line. I'll do the best that I can. Whoop, we did a terrible job there. Let's try one more. Okay, so that's a straight line. I'm going to eyeball this kind of to the middle of their skull. And I'm going to make that line a little bit thicker for you right there. So smack dab between the eyes here. But you can see that their jaw is swinging over. If I was going to point then at where the midline of their jaw is, the midline of their jaw is right here. That one's out of frame. Let me slide that up a little bit. Midline of the jaw would correlate with this spot, that little pink dot that I've just shown right there. And you can see that this person has wires on the base of their teeth. They've had a whole bunch of dental work. You'd think that there would be a huge amount of space. For the teeth, yes, but the teeth are not the person's problem here. The problem is that they've got this compression issue that's going on toward that right side. They've worn the splints, but it's like everything just feels like it keeps getting tighter and tighter. What we found is that the misalignment component that they have, just like me, it's on the left side, even though at face value we would think that it's on the right. And they haven't yet started a different type of dental care, but what this person needs, they need that right side jaw to swing more toward the left. This is actually a slightly different case, and I'd have to go back and review her films, but I was first aware of this when I had a client some many years ago, chronic migraines, and she did good. She did really, really good when we were adjusting her neck. But she never stabilized her alignment quite as much as she wanted. And she was referred to a neuromuscular dentist. And in the beginning, her jaw was like all the way over like this. And that was kind of what prompted, yeah, you need this kind of care. Now, I didn't see her for the span of like 2 years. And when she did come in, she's like, I've been doing great. And I had a look at her jaw. Her jaw was actually all the way over to the opposite side. And I'm thinking, whoa, what in the heck is going on? This is not good. But this is my point. Functionally, she was doing so terribly much better. Who am I to argue with that? My point is that the dental alignment is very important, but what's far more important is your body able to compensate for that? Because if you've got abnormal muscle function, abnormal nerve function affecting your jaw, affecting your teeth, you don't necessarily want to have a $1 million smile. Much better, you want to have a functional smile to where even if the teeth would be quote unquote slightly crooked, that you're able to do all the things that you want to. You have to respect a person's normal anatomy and then work with that to find what the breakthrough is, even if it means that the jaw is a little bit off center. Here's the second person. You can see again, they have had most extensive types of dental work. All of these white things that you see, these are crowns, these are posts down at the bottom, and exact same thing. They've got this compression that's all shifting everything toward the right side. If they are wearing a splint, the splint is going to expand into that point of compression. They're going to be feeling so terribly much worse. So same thing. This is something where, what did we find? That despite, appearances, the misalignment this person has is in the neck is on the left side, and what this person needs is they need dental care, which is going to help to swing the jaw over toward the right side. And it's different than just like the normal kind of appliance that we get at the general dentist. And this is the last case to illustrate that it doesn't always have to happen on the right side. So this one here, you can see the asymmetry, and I've outlined them here again, where you can see that the base of the skull, it's not level. They had that shift that occurred. We can't change that. So what we have to do is we have to accommodate for that. This person here, it was very interesting because when I was looking at the rest of their x-ray images, they have a plain as day, just like me. A plain as day misalignment on the left side, but I wrote a note for all of the rest of our docs here. It's like, that is a trap. We have to make sure that we're not adjusting that. We need to be focusing on the misalignment component we found on the right side, and what we need to do that is we need to get her to the right dental specialist to help decompress, bring the jaw over toward that right side. In other words, the exact opposite of what we would normally be thinking. So as much as I'd like to say that if you were to look at the collective wisdom of upper cervical chiropractors, TMJ specialists, physical therapists, neurologists, ENTs, medical specialists, the reality is that there is so much about the human body that we still don't know. We were always discovering new things, new functional relationships. And just because a person may have had an MRI or a CT scan, and I say no broken bones, no dislocations, yeah, you might have some arthritis, but there's no bleeding, everything is normal, does not mean that everything is actually normal. What we instead have to do is we have to take the step back, be willing to look outside of our lane to realize, okay, this is what's actually going on. It's how this little piece here is affecting this little piece here, and it's affecting this little piece here, and that we have to work collaboratively as a team to find the best possible solution, and also what the hierarchy of care is. There's no one magic silver bullet. We have to look at everything and realize, okay, when people do have more of these complex health issues, odds are it's going to require picking a combination lock in order to get that breakthrough. It can be very challenging. It can be very expensive, as I can also testify.